How's it going? What are SATA questions? What are the tips and tricks for tackling SATA questions? This is Lynn from Nursing Academy. Without any further ado, let's see a SATA question in detail. First of all, what are SATA questions? They are select all that apply questions, right? In these type of questions, any number of answers may be right, like all of them or even only one of them. We should have thorough knowledge to tackle these questions. In the end of this video, I will explain the tips and tricks of tackling these type of SATA questions. Let's do a SATA question in detail so that you will get a clear picture to answer these questions. A nurse is providing discharge education for a patient admitted with MI. The patient is on the following medications. Which statements from the patient indicate a need for further teaching? Aspirin 81 mg per oral daily, metoprolol 25 mg per oral daily, simvastatin 40 mg per oral at bedtime, clopidogrel 75 mg per oral daily, nitroglycerin 0.4 mg PRN. You have to read the question twice before answering the questions. What are the keywords in these questions? It's discharge education. Second one, it's a patient with MI. MI means myocardial infarction. Then we have to have a close look at the questions that are opted for the patients, like aspirin, metoprolol, simvastatin, clopidogrel and nitroglycerin. Just pause the video and comment down the answers on the comment box after reading the question twice. I will give you 1 minute time to answer the question. Guys, I hope you got this question right. Anyway, let's do this question together. So while dealing these type of questions, I already said you we have to read the question twice. Then we have to find the keywords in these type of questions. For example, in this question, the keywords are discharge education for a patient with MI. MI means myocardial infarction. And then we should have a close glance at the medicines which are prescribed for the patient. Then the major keyword is that what the question is asking is which statement from the patient indicates a need for further teaching. That means the question is asking a negative response, not the positive response. Guys, I'm telling you that majority of the questions got this point right. They will just read the question and then they will jump into the options and they will find the good statements instead of the negative statements. So we have to read that carefully, and it should be in our mind that the question is asking the negative response, not the positive response. Okay, so which statement from the patient indicate a need for further teaching means the answer should have negative responses. I think that part is clear. Okay, then just get into the options. Let's start from the medicine and its actions. Aspirin 81 mg per oral daily. What is the action of this aspirin? It's anti-platelet drug. Second one, metoprolol. What is the action of metoprolol? It's a beta blocker. Okay, that is commonly given for hypertension. Third one, simvastatin. What is its action? Simvastatin is an anti-hyperlipidemic drug or anti-lipidemic drug. Okay, that is given for cholesterol. Then fourth medicine, it's clopidogrel. Definitely it's an antiplatelet drug like aspirin. And fifth one, it's nitroglycerin. What is the action of nitroglycerin? Yes, it's an anti-anginal drug that is given for the chest pain. Okay, then let's do the options one by one. Our first option, take aspirin before breakfast. Is that right? Think. What is the action of aspirin? Yes, aspirin is an antiplatelet drug. That means aspirin always have a bleeding risk or ulcer formation risk. So we have to have aspirin only with food to avoid the gastrointestinal disturbances. Never have aspirin before breakfast or on empty stomach. That means this statement is wrong. This statement is wrong means this is going to our answer, because what the question is asking is to find the wrong or negative responses. So A is our answer, one of our answers. Our next option, take nitroglycerin after 5 minutes of chest pain. Is that right? No. Why? Because what is the action of nitroglycerin? It's an anti-anginal drug. That means it will dilate the veins, it will reduce the venous return and also reduces the coronary artery spasm. Clear? So, how will we have this drug? Guys, in order to have this drug, we are having a protocol. What is that? If we have chest pain, at the onset of chest pain, we have to have the first tablet. Then we have to be relaxed and wait for 5 minutes. If our chest pain is not relieved in that 5 minutes, we have to have the second tablet and at the same time call the emergency. And we have to wait till 5 more minutes. And if our chest pain is not getting relieved or if it is getting worsened, we have to have the third tablet. Then how will we have this medicine? We have to place these medicines under the tongue and give time to dissolve. Then there is also one strong point in the storage of these drugs, because these drugs has to be stored in dark bottle in their original containers. Okay, so that's all about this nitroglycerin, and this statement is also wrong. That makes this option our answer. Our third option, report muscle aches and tenderness. What does this muscle aches and tenderness denotes? Yes, it's myopathy. So, if any person is taking statin drugs like simvastatin, we have to report the muscle pain because it indicates rhabdomyolysis. You might have heard this terminology, rhabdomyolysis. What is that? It's quite simple, that a damaged muscle is releasing electrolytes and proteins into the blood, causing major organ damage. Next is our option number D. What is it? Avoid sudden changes in position. Is there any drug that makes the patient dizzy? Yes. If we are taking the drugs like metoprolol, propranolol, that LOL drugs, we have to have that caution because these drugs may make us dizzy or it may cause orthostatic hypotension. So what we have to take care? When we change the positions, we have to do it slowly. So this option 2 is right because we have to change the position slowly. So this option number D is not going to be our answer because we are choosing wrong options. This should be always in your mind while you answer the questions. Very important. Then let's go to option number E. Black stools or bleeding is common while taking these medicine. No guys, this is wrong. What are the medicines that the patient takes which makes the patient vulnerable to bleeding? Yes, here the patient is taking aspirin or clopidogrel. What are these drugs? They are antiplatelet drugs that makes the patient bleed. So, the patient has to report even the minute bleeding or bruising in their body. So, this option is wrong and it's our answer. So, what are the correct answers for this question? Option number A is wrong, option number B is wrong, and option number E is also wrong. So, here the answers are A, B and E. Now, we have answered a SATA question. What did we learn from this? In these type of questions, any number of answers may be right, like all of them or even only one of them, I repeat. So, we should have the courage to answer what we know and what not we know. This is the tip number 1. My dear students, always keep in mind, we should answer only what we know and not what we don't know. Tip number 2. Treat each option as true or false statements. What does this mean? We have to read each option carefully and think. In NCLEX, you may heard some students saying that they are getting mostly SATA questions. This is the way NCLEX trick you guys. If you are having thorough knowledge and critical thinking, then only we can answer or make these questions right. So, it's very important to practice as much as SATA questions you can. Tip number 3, don't go over similarities. You may find some terminologies in the options that may look similar. For example, if we find bleeding in one option and in the next option, you may also find bleeding plus something else like numbness or soreness. Some may think that both of these options are right, but they may not be. Okay, so always keep in mind, similarities may not be always similar. Tip number 4, make sure the answers are focusing on what is being asked in the question. Be alert guys, never redirect your focus when you are going through the options. For example, if we are reading an option, it may be right as per true or false statement, but it may not be our answer or what the question is asking for. You should have the question always in mind when you go through the options. Tip number 5, eliminate the wrong responses first. This is a simple tip. When we get a question, we have to eliminate the wrong responses first, then go for the right responses. In that way, we can answer the SATA questions easily. Why? Because if we are eliminating the wrong responses, that itself is the proof that we know these questions or how to answer these questions right. So my dear students, these are the 5 tips that we can apply on the SATA questions. Do as much SATA questions as possible. In that way only we can tackle these questions. In the very beginning, when I started answering these questions, I also found very difficult and I feel exhausted at some times. Then what I did is that I just formulated a plan for me, like these tips. Then I begin to apply these tips in my questions. Then majority of my answers has got right. If you are having any questions, please feel free to comment down in the comment box. If you like this video, please hit the like button. Please like and subscribe and share it to your friends. Without your support, we cannot move further. That's all for today. Thank you. Bye.